Welcome to our webinar. It's on exploring career in healthcare. My name is Hema Sani. I'm a public service librarian at Plano Library System. I will be the moderator for today's program. And the reason I'm moderating today's program because I have been a health and medical librarian for many years, and I've helped physicians, nurses, and clinicians with their evidence-based practice, helping them with their research needs. And today we have our expert panelists. They are from Texas Health Plano, Children's Health and Collin College. We also have our chat moderators, Sabrina and Caitlin. All the attendees' mics are muted, but we request you to ask your questions on chat, and we will try our best to address all your questions. So we will start the program with our panelists. They will introduce themselves. They'll talk about their education and a little bit about their career path.
Hello, everyone. My name is Alfredo Gonzalez. I am a patient care technician at Children's Health. I've been at Children's for 8 years now. And then I was transitioned into a team leader role. So I manage patient care technicians in our department as well. The career path that I've chose, I am in healthcare and administrations, pursuing a clinical manager position.
My name is Michelle Millen. I am the Dean of Health Sciences and Emergency Services at Collin College, and I am a registered health information administrator. And I served in that role in a Chicago hospital system, and then came here and have been with Collin College in a director role for about 10 years, and then as dean for a little over 3. Shannon, you're on mute.
You're muted.
Sorry about that. Hi, my name is Shannon Gutierrez, and I am the radiology director at Texas Health Respiratory Hospital Plano. It's located off of Parker and the Tollway. And I oversee all of the patient care that happens in CAT scan and MRI, X-ray, ultrasound, nuclear medicine, mammography. And I have been practicing radiology for 28 years. And so I've had a lot of diverse experiences.
So we have a very diverse group of panelists here, and I would like to know that in your respective field, what are the challenges or barriers that you face along the way, and explain that how you overcome them?
I'll go first. Again, my name is Alfredo Gonzalez. I'm one of the patient care technician team leader here at Children's Health. I think one of the main challenges that we see here, since the pandemic, we've been having a lot of in the influx of patients. Our census has been really high, and we have a lot of sick kids. So especially with respiratory viruses. So we feel like it has been, typically our summers are where we have a decline in our patient census, but since 2020, since our pandemic started, we've had such a high increase in our patient census. I think just offering staff more extra shifts to pick up, that has been helping with staffing shortages. And then of course in our department, we are the clinical resource team. So we float throughout the organization to backfill those departments' needs. And so we are getting cross-trained to different areas, getting extra competencies or skills so we can kind of expand ourselves, expand the help that we can offer throughout the organization.
Anybody else would like to share their thoughts?
I'll let Michelle go next, and we can just stay in that order and make it easy.
For me, as far as barrier, I think one of the biggest barriers in healthcare is appropriate education and training certification. You've got to make sure that you have what is necessary for the job that you want to do. And so for me as dean, not only did I need to make sure that I had my healthcare certifications and that background as dean of a healthcare division, but I also needed to make sure that I had education that allowed me to rise to the level of dean. So I think from a healthcare perspective and a practitioner perspective, one of the things that I recognize for folks that are really interested in getting into healthcare is the fact that they really need to understand what certifications are necessary, and then to go to an educational facility that is accredited to offer those kinds of certifications if accreditation is required. And that's something that prospective students really need to make sure they understand is what kinds of certifications are going to get me there, and then what institutions are available to do that, and that depending on the role, those associations have those accredited or you know the appropriate educational facilities on those websites.
So for me, I started an X-ray school directly out of high school. And one of my big challenges was I was not raised in a family where my parents went to college and they didn't know how to help me get into college. And I have some learning disabilities. I'm dyslexic and a slight touch of ADHD. And so I had to really understand my learning style. I had to understand what environment works best for me. And so being in clinical practice is very helpful because not only did I get the classroom work and the knowledge there, but I also had the opportunity to apply it hands-on in my clinical programs during my schooling. So that's been very helpful for me to grow and to learn. It's been really challenging over the last 28 years. I think the key has been to be very flexible and very adaptable. When I got into X-ray school, HIV was first coming out, which was very intimidating. And trust the process, trust that there's a lot of research and literature. Most recently, we've had COVID, we've had Ebola, we've had, so it's about staying the course and being flexible, but really knowing what works best for you. For me, I didn't want to sit at a desk all day. I wanted something that I could be out and about and working with patients. My ADHD was very good for me because I have short patient interactions, 30 minutes, an hour, where some other healthcare professions may have them 12 hours if you're a bedside nurse. So just finding the right specialty for you is really important.
So I believe we have some questions. Sabrina, can you ask those questions, please?
All right, I believe some of these will be answered throughout the presentation. But one of the questions is, what is it like to be an audiologist? And the other one is sort of related. It says, let's say I want to be part of the health field, but not interested in being a doctor or nurse or surgeon. What career options are those?
So anybody would like to share their thoughts first?
So I can tackle the second question. As far as, what options are available if you're not interested in being a doctor, a nurse, or a surgeon. You got a lot of options available. And I manage, I think, 17 different programs. So there are ranging from what Shannon does in imaging. So that's radiology tech. You've got diagnostic medical sonography in the image space. There are a lot of different options. You've got respiratory therapy. So if you're interested in trying to help people breathe, I think one of the things that you want to think about is what kind of an environment works best for your, for who you are. As Shannon mentioned before, understanding who you are and how does that environment fit your specific learning style, your needs do you want to be stationary and work behind a desk? There are ways that you can be involved in healthcare from that perspective. Or is it something where you want to be on your feet all day long? You want to be active, you want to be engaged, do you want to touch patients? Do you not want to touch patients? All of those questions are things that you want to be able to answer so that you can find the best possible fit for your individuality. And you know, any higher education institution that has a healthcare focus can help you with that.
And regarding the first question of audiologist, Ms. Michelle, do you think Collin College has any such certification program?
We do not for audiology.
Okay.
I believe that at this point, audiology is a master's degree program.
Okay.
And so that is something that someone would have to have not only their bachelor's degree, but then apply to a master's degree program. I will say that really across the board, our healthcare programs are competitive. At Collin, all of our healthcare programs have a selective admission process. There are some of them that really admit only a small percentage of what the overall applicant pool is. So when students recognize their what it's going to take to be successful in that program and to be successful in the admissions process, it may take, you know, good grades and recognizing, you know, the drug screens and background checks and all of those things that are required. That's all part of this process. So I think that, as Shannon mentioned earlier, you know, the pandemic isn't the first time that we've dealt with healthcare crises. And so if you are someone who shies away from that kind of thing, healthcare may not be the best choice, because this isn't the first time we're faced with these kinds of challenges, and it won't be the last. So you got to know and be prepared that you are someone who can be a contributing member of that healthcare team.
I would tell you that you can get involved in being a healthcare worker at any level, at any stage of the game, from, you know, clerical workers, registration clerks in the emergency room. Alfredo will talk to you a little bit more about his role, you know, as a PCT. A lot of times those individuals are, you know, in that role while they seek higher education, whether it's to go into radiology, you can work in the laboratory as a medical laboratory tech. You can work, you know, the lab's great. If you don't really like interacting with people, if working with the public is not what you're interested in, you know, the laboratory has a lot of positions, phlebotomy, medical laboratory. So there's definitely a unique feel to each of the specialties. And I highly encourage you to check that out and figure out what you want. Radiology is very technologically advanced every 5 years. We're getting new equipment, it's progressing. So if you like to work with technology, you know, that might be a good area for you. You know, physical therapy, you can be a physical therapy aide instead of going to physical therapy school to get a master's degree. So at all education levels, there is an opportunity to engage in the healthcare employment world.
Yeah, it's interesting that you're talking that they can, you know, work in different levels, and we have a, you know, related to this, we have a very interesting question, and somebody is asking, how do you manage work-life balance in an extremely demanding environment like medical field? So what do you have to say for that?
Question go to any one person, or?
Like, you know,
I can answer that question.
Okay.
I think, sorry, the lights went off in my office.
Okay, sorry.
So I think it starts with recognizing that, of course, it's such a demanding job. There's a lot of opportunities for working extra shifts and things like that, and it's such a demanding environment. But one of the most important things, of course, like as I mentioned earlier, is especially in a healthcare field, is that we've been super busy lately. But I think it starts with you recognizing that, hey, I understand that financially I could pick up an extra shift, but also I need to take care of myself. One of the most important things throughout the pandemic was, of course, being able to be with your family. I think that's one of the most important things, to have that opportunity to just spend that time with your loved ones, because that's really just taking the time to really recognize that I need to just have a relationship with my family, see how everybody's doing, check in with everyone, and also do some things that you really enjoy. Of course, I love enjoying playing soccer, hanging out with friends, even if it's just to chit chat and watch a movie and drink some coffee. Just really recognizing that it is okay to take a step back and take some time for yourself. Do some activities that you really enjoy to do. I think it's really easy to say, yes, I can work another shift. But it's also really important that when your ball is deflated and you're feeling extremely tired, that's the opportunity for you to recognize, I need to take some time off. And I'm going to do what I can to get the rest that I need, spend the time with the loved ones that I live with or that I would love to hang out with. So reach out to some of your friends, some of your family members, and take that opportunity to spend some quality time.
We have a lot of questions, and Sabrina, would you ask another question that we have from our attendees?
Sure. We have one that says, I will be taking dual credit next year and wish to take some medical related courses. What is offered? And a related question is, what's a piece of advice or opportunity you would recommend for high schoolers looking to enter the medical field?
So I would suggest that you take medical terminology. And the other class that is almost always required is anatomy and physiology. Those are transferable to any healthcare program you decide to apply to. So I would definitely start there.
So we have, for dual credit, we have a partnership with Plano ISD called the Health Sciences Academy. And we offer, I think there are probably 6 or 7 pathways in that space. Anything from certified nurse aide, PCT. You can get your PCT certification as a high school student. You can get EMT. You can do medical assisting. Medical scribe is something that is often offered dual credit. So depending on where you are in your, where you're located and where you may be taking classes, you also can enroll as a general pop student, so not necessarily dual credit, if you think that that's something that you want to pursue in the summer. I will say that depending on what you want to ultimately pursue. So if you're a dual credit student that thinks you might want to go to medical school or nursing school or one of the other competitive programs that we've kind of talked about, we are seeing, and the Texas the Texas medical school application outlines that they really want to see some experience before someone applies to medical school in the state of Texas. And that means that you may want to get a little bit of experience as a PCT or a medical scribe, or they've got a list of various options that they recommend. EMT is another one that they recommend. So I think what I would like for folks to take away is, if you think that you're going to use maybe some of these foundational courses or foundational certifications as a stepping stone to something else, that's a really good strategy, because in healthcare, it's really important for those programs to recognize if it is a higher level competitive program, they want to make sure that the students that are applying and are interested understand what it means to be in healthcare. As you can imagine, you've got thousands of people applying for just a couple hundred spots in medical school. And they want to make sure that the people that they bring into those programs are people that understand what they are really signing up for. The sights, the smells, the sounds of healthcare are unique. And to be able to recognize and understand that, yes, I want to pursue this is really important. And those foundational experience type certifications can help you demonstrate that.
Yeah, that's good to know. And we have a couple of more questions on that. Actually, somebody's asking, are there jobs at hospital without certifications? Like he or she wants to get in the door without committing to a certification first. So those who are working in hospital, what do you have to say for that?
Absolutely. There are jobs that are available without a certification required. We talked a lot. There are a lot of administrative type positions. There are positions where registration and really even patient navigation. So hop on these websites at the hospitals. They've got their job boards. It's very easy to navigate, and you can get your feet wet and then determine maybe what part of healthcare you're interested in. So, healthcare is it's a family, and you're able to get in regardless of what your training might have been. If you want to pursue something, there's a way for you to do that without spending a whole lot of money or time in certification. Now, if you know exactly what your role is in that, or what you want to do, that hospital job board will tell you if you require a certification of some kind.
Great. Sabrina, I think we also have one more question from a high schooler. Would you like to ask that?
Yes, it seems similar to some of the others. It says, I'm in a practicum program at my high school. What do you think I can do outside of school involved with medicine to help with applying to college next year?
So this is Shannon. I have served on several selection committees for radiology programs and just other programs in general. I think if you can volunteer, particularly I have a high school kid who's 17, going through the college application process right now. It is rather daunting, I'll admit. But I would highly recommend that you do some volunteer time in healthcare if you want to get into healthcare. Colleges really like to see your volunteer work in a really focused area. If you have the ability to do that, I know that the hospitals do take summer volunteers. It's a great way to get a lot of volunteer hours pretty quickly in your area of interest. The other thing that I often recommend is you can get a job as a patient transporter. All you have to have is CPR, and that job really helps move patients to and from their room to other departments for testing, like respiratory therapy, radiology. I mean, it really gives you a lot of experience in many areas because you'll interact in every department, and you can really see what you like and what you don't like, and being able to put that on your college resume is very helpful. I will tell you that a lot of organizations, such as Alfredo's and mine, if you work at the hospital, I can speak only for mine, if you work 24 hours a week, they will pay $5,000 towards your tuition every year. So not only are you getting a good experience, but as long as you're employed, you can get some tuition assistance. Very helpful.
That's a great suggestion. I think we have one more unanswered question. Sabrina, can you ask that question?
Yes. So switching tracks, it says, I don't understand the biomedical engineering field. Is it a part of the medical and health field or engineering and technology field? And do you know what kinds of jobs people in biomedical do?
So we have biomedical engineers that work on our radiology equipment. I think it's really the best of both worlds. You get the engineering aspect, but you also get to work in healthcare. I think that role is increasingly more important. As a clinician, I'm only as good as my equipment, right? So if I can't take your X-ray or I can't do your MRI because my machine isn't working, you can't get the care that you deserve. And so, having equipment that is operational at its peak performance makes a drastic difference in our diagnostic abilities and our abilities to produce quality testing for interpretation by the physician. So that's my take on biomedical. I've never worked in biomedical, but they're an instrumental part of what we do.
So, anybody else would like to throw some light on this? So we had a lot of questions on certification and associate degrees. So I would like to ask, what do you think? How much can a person make in healthcare field with an associate degree or a certification course?
It varies. It varies quite a bit. So I think one of the things that if you, for example, if you get a degree in respiratory therapy and become a certified licensed respiratory therapist, then you can make $65,000, $70,000, depending on where that role fits within the scope of the standards of practice and care. Diagnostic medical sonographers are making a nice living right out of school. Yes, it is an associate's degree. It is something that is, you really have to have an understanding, and Shannon can probably speak to this better than I can, but you have to have an understanding of physics and the way things work. So it's a little bit of a different type of hands-on clinical role. Then you may have someone who, for example, at Collin, we have a surgical assist program, which right now, my understanding is it's the only surgical assist program in the state of Texas. So you can get your associate's degree, get a surg tech certification, become a surg tech for a couple of years, go back to school, get a certificate in first assist, and those folks are the right hand of the surgeon. So really what that means is, with an associate's degree, 2 years of experience, and a certificate in surgical first assist, again, with that certification, you can be making, $80,000 or more. And in that role, you're billing for services. So there are some real options to what someone can do with some certifications. I think, again, what you need to think about is, what type of environment am I interested in working in? The OR space is a very different environment than a doctor's office, and how that works. So you really need to think about what kind of environment you thrive in.
That's a good suggestion. We have a couple of more questions. Yes, Shannon, go ahead.
Alfredo, they have a on-the-job training program. Is that correct, Alfredo? And so I think that's important to let him talk about that for a minute, if you don't mind, Alfredo.
Yeah, sure. Yes.
Yeah, absolutely.
And work at the same time.
Yes. So I was going to mention, actually, in one of the previous questions, we do have a patient care technician apprenticeship program here at Children's Health. This is our third year partnering with Dallas Community Colleges. For example, this year we're partnered with Brookhaven College. They do the curriculum classroom setting, and then in our department, I manage the clinical rotations of it. So you are a full-time employee with full-time benefits. It's all paid for you up front. you learn the classroom setting on how to become a patient care technician, and then you come to your clinical rotations here. And throughout the year, you'll be learning how to get checked off on your skills and competencies that you have to, on how to make you a successful PCT. And then after that final, closer to that end of the year, we prepare you to take your certification exam. And again, this is all on the job paid training as well. And then once you, of course, fulfill this year requirement, you're still eligible to go back to school if you wanted to. So this is really a good opening for a lot of our students. We've had here at Children's Health a lot of applicants through the PCT apprenticeship program. This last cohort, we had over 200 applicants for 10 positions, unfortunately, this time, because we are constantly hiring throughout the year. I wish we could have taken more, but at the time we only took 10. But it's a really great opportunity to introduce you into the healthcare field. You're working closely with a lot of different disciplines. You're working directly with a nurse or nurses. You're working with providers. You're working with speech pathology, different healthcare disciplines in the organization that are really patient facing. In a lot of our previous PCT apprentices have enrolled back to school, and they're looking into like speech pathology with full tuition reimbursement here at Children's Health as well. And we've just recently just changed one of our requirements. So as soon as you're hired here at Children's Health, you are eligible for full tuition reimbursement, which is $5,350, which is really, really super beneficial.
Mm-hmm. Shannon, would you like to add something to that?
I think that I sent some information over to the library that you guys will be posting online. We
Yes.
have a PCP program similar to that, but we also have one pharmacy tech. So, you see when you go to pharmacies, Walgreens, there's techs there that prepare your prescription side by side with the pharmacist. Well, hospitals employ those too. And so we started a pharmacy tech program where you can get paid to train and for a commitment that you will work as a pharmacy tech in one of our hospitals for a certain period of time. Again, another great way to go to school and get paid while doing it. And then there's some other information out there that I sent in for just radiology.
Yes, and we are putting all this information also on our chat for our attendees, and to go to all these pertinent information that we have put on a Google Drive. And we also have some more questions. Sabrina, would you ask? We have a list of questions, so let's see what all we can cover.
Yes, so there are a couple that are similar to what was being talked about before. So one was, are students who have been in clinical rotation programs considered more than students without? And what are the prerequisites recommended for someone interested in pediatric oncology?
So when you look at pediatric oncology, your first step is going to be medical school. And to get through that process. So that's your first way to tackle that. And then it's a matter of saying, okay, I want to be a pediatrician potentially, and then an oncologist. So there are a lot of specialties that are wrapped up post medical school. But the real challenge, well, one of the challenges is medical school. Then your next challenge is going to be residency. And so there are a lot of tests in between, and there are a lot of considerations about how that all falls out. Pediatric oncology is a very noble specialty, but there are a lot of hurdles to jump before you get to that point. So I think that your first step is going to be in finding a medical school. And when you look at what your requirements are there, I would say tap into the Texas medical school application and take a look at what they're looking for. And then you want to make sure that you've got a way to demonstrate how to answer all of the components that they're looking for. What was the other question, Hema?
Oh, it was
Oh, I'm sorry,
our
Sabrina.
students. Yeah, no problem. It was our students who've been in clinical rotations programs considered more than students without.
And I think that what we've seen, Collin has a nursing program, and it is competitive. And what we've seen is when a student can demonstrate that they've got some experience in healthcare, it's always a benefit. So, you know, as long as you've put your best foot forward, and that's the other piece that I would say is when you apply to these programs, when you're talking about what Alfredo was talking about, as far as some of these on-the-job apprenticeship programs, 200 applicants for 10 positions, that's competitive. And so you want to make sure that you've put your best foot forward in any application that you submit. So good grades, you know, if there's test scores involved, good test scores. And for sometimes when it says, you know, the minimum is a 2.5, that's just the minimum to be considered. You're really competing against the pool of students who have applied during that same application period, which can be very competitive.
And this program, we are basically focusing on certification or associate degree that can lead you to a healthcare field. Yes, Shannon, what are you talking
So
about?
in pediatric oncology, one of the things that you may want to consider that's not being a physician is radiation therapy. You know,
Oh, wow. Yes,
you can
yes.
go to radiation therapy school, and you know, once pediatric patients are diagnosed with cancer and they have to get radiation therapy,
Yes.
you can treat them with that therapy. So that is something that doesn't require a doctoral degree or a bachelor's degree, but it's a way to work in pediatric oncology. And if you just want to work with children, you know, pretty much all the allied health specialties, you know, there's children's hospitals like where Alfredo works, but it takes a special, kind-hearted person to work with kids. One of the things to consider, Alfredo would probably be a testament to this, is you're not only treating the patient in pediatrics, but you're treating the family.
Yes.
So everybody's going through something, and so you have to educate the patient, which is the child, but also the parents and the family who are probably having the worst moments of their life, to be honest.
So if they do take a radiation therapy certification or associate degree, do they have to further specialize themselves for pediatric or it's the same?
Fairly, no, they would just get
Okay.
hired at a pediatric facility, but it is one way to work with pediatric oncology patients, but not be in medical school.
Okay, that's great. So Sabrina, do we have any more question that you think is appropriate?
Absolutely. So one is kind of broad, but it says, what is the best path to take to become an anesthesiologist?
You have to go to medical school.
So any of these anesthesiologists, oncologists, pediatricians, surgeons, all roads lead to medical school.
Yes.
So that's your first hurdle, and that will be that's your first jump.
You can consider being a nurse anesthetist.
Mm-hmm.
Yes, nurse anesthetist.
Yeah, that's an option. I think the interesting thing to point out is everybody thinks of doctors and nurses, but there are so many ways to get to the same space that you just really have to think about and explore. They're just not as widely advertised.
And I think the other piece is that recognize what you are really committed to do. So when you think about medical school, you're thinking about 4 years undergraduate degree, 4 years of medical school, potentially 5 or 6 years of residency, maybe 2 years if it's 3 years if it's internal med, but that's a significant commitment in education before you can even start making a significant wage. Whereas someone who may get an associate's degree in diagnostic medical sonography or respiratory care, they're coming out of their 2-year degree making more than a resident makes after 8 years of school. So I think there is a lot to be considered. And as Shannon and Alfredo have mentioned, so many other pathways than just nurse, doctor that can significantly contribute to the overall health of a patient, the overall positive outcomes of that patient's stay. And I think I hope if you don't take away anything else from tonight's conversation, I hope you take away the fact that there are so many other people involved on the care team of patients, and they aren't doctors or nurses potentially.
I would highly suggest, I would never talk somebody out of wanting to be a physician. It's a noble thing to want to help people no matter what avenue of healthcare you work. Highly recommend that you interview some physicians, talk about what their challenges are today, talk about what their challenges are that they're facing in the future. I've had some physicians say they wouldn't talk to children in treating healthcare. There's a lot that physicians face with declining reimbursement, increases in litigation, stress. Someone mentioned earlier work-life balance. How many nights are we going to be on call? Just spending time with your family. So it's a worthy profession. Don't get me wrong, but just really make sure you investigate it and that it's the right place for you.
All right. We do have some more questions still. Let's see. One of them says, I've done a bachelor's degree in herbal medicine and surgery from India and practiced in allopathy maternity hospital. What can I do to pursue my career in the medical field here in the US?
I would suggest that you take a look at what it is you're actually interested in and see what that looks like from a certification perspective. So you really kind of want to marry the skills that you already have with some of the certifications that are available here. And you may have to go back to school for that particular certification or get some kind of education. But I think that probably your education that you've received in India will certainly benefit you as you pursue whatever it is you want to do here. But I think it's going to take a little bit of legwork to try and determine what path you want to go here, and then pursue that based on who might offer that particular program.
We are also having a question. Somebody is asking about whether do you recommend a BSMD program over the traditional 4-year college, then applying to medical school?
So the BSMD program is a guaranteed option for someone who is, in essence, admitted to for medical school consideration as an undergrad. I think they can be very good programs for students because for many of them, an MCAT is not required, or the MCAT is required, but it's the score isn't necessarily a consideration. So you'll want to make sure that you select or that you investigate all of the different nuances, because not every BSMD program is the same. The other piece about BSMD programs is they will want to see some sort of healthcare experience. And so because it's a BSMD program, that means you got healthcare experience in high school. So you'll want to be able to demonstrate what that clinical background, your clinical background looks like. And it probably needs to be pretty robust, because those programs, again, attract a significant number of students who not only have good grades, good test scores, but they also have some experience in healthcare.
And just related to that, somebody's asking, what is a BSMD degree? Like, what's the full form?
So the BSMD is an opportunity for a student to be admitted and graduate with their bachelor's degree, and then continue on into that medical school. So for example, in Texas, we have, and I don't know if we still do, we did a couple of years ago, a joint admissions medical program where you've got someone who may go to school at A&M. They're admitted through this joint admission process, and then they go to the A&M medical school. Some of these joint admission programs will require that you go into a certain specialty. So in the state of Texas, we have a shortage in our internal med type physicians. So there are some of these joint admission programs that say, you know what, we'll admit you as a graduating with your degree in whatever it is, your BS, and we'll admit you as long as you are in internal med or one of the other programs. So they're not all created equally. You really need to do your due diligence, but it is an opportunity for someone who is an incoming freshman to already be basically admitted into medical school.
And what would you say is the average income for an internal medicine physician?
I think it's tricky. I think that depending on where you live, I think that those folks, there are other roles in healthcare, believe it or not, that make more money than an internal med physician. And that's part of why we're struggling in those roles, because they just don't get the compensation that you would think they would get.
Yeah, a lot of it depends on the community in which you work, how well insured the community is, how affluent the community is, are they able to pay their deductibles?
Yeah.
I kind of heard a range of 100 to
130.
Yeah, $1,000 a year. I will tell you that an MRI tech who has gone through a year and a half of X-ray school and then another 6 months of MRI school, the pay is anywhere from $71,000 to $100,000 a year, and
Yep.
you've only invested 2 years.
Yep. No,
and so, you've got 4 years of college, 4 years of medical school, and then 3 years of residency. Versus 2 years to make the exact same amount of money.
Yep.
Provided that you find it worthwhile work, right? Like,
right.
Enjoy what you do. It
Yeah.
doesn't matter how much money you make. If you don't
Right.
enjoy what you do. So find your purpose and be happy.
So since today we have professionals from different background, it'll be nice to know our attendees would, I guess, would be it'll be beneficial for attendees to know what is a typical work day is like for you, if everybody will throw some light. Since you're professionals, they will learn something that, okay, if I get on this role, this is how my work day will look like. Would you start, Alfredo?
Yes, of course. So here at Children's Health, the patient care technician role, especially in our department, varies a little bit. The roles and the responsibilities remain the same. We are a float pool department, so we backfill the needs of every department in the system in the organization. So we go from the emergency department up to the critical care units. So we are a big family without walls, because we go everywhere. And our typical day is, for example, a patient care technician can be assigned to between a range of 12 to 16 patients, and you'll be working with multiple nurses on that unit. And that patient care technician is responsible for routine vital signs, obtaining laboratory collections. So, for example, phlebotomy skills. So you'll be obtaining blood, urine collections, stool collections. You'll help with new admissions. You'll help with simple bedside procedures, like starting peripheral IV. So you can also do other simple procedures like urinary catheters. You can help with discharging patients, admitting patients. For example, you'll also be one of the most important roles and responsibilities here at Children's that has really changed the role of the patient care technician. We have seen a huge increase in our behavioral health population, even from the smallest kids from like 5 years of age up to 18 here at Children's. So one of the main responsibilities that the patient care technicians take is they're assigned as a safety assistant. And so what we do is we take on that responsibility to sit and observe the patient one-on-one. We get more enhanced training to how to de-escalate a patient when they are here for suicidal ideation. Kids who have aggressive behaviors, kids who have a self-harm, kids with elopement precautions, so your runaway kids who have a overdose, and so they're having altered mental status at that time. And so the most important thing is to keep them safe, keep ourselves safe. And we're, like Shannon mentioned earlier, one of the most important thing is that we are also treating everybody in that ring. We're taking care of everybody. So we approach that as a whole child approach here at Children's Health. And so we're taking care of that mother, that parent, the patient, and any other visitors that are in that room, and always keeping that environment safe. So those are some of the roles and the responsibilities here at Children's Health as a patient care technician. So you can have from 12 to 16 patients, or you can be assigned to be a sitter or a safety assistant one-to-one with the patient as well.
Oh, that's wonderful. Anybody else would like to say something?
So in radiology, it really depends on your specialty. So you typically go to radiologic technology program, which is your general imaging. And then if you choose to subspecialize after that, you want to go into CT, you want to go into MRI, you know, that day will look very different. But when you first graduate, you'll be working with patients in the ICU. You can do trauma patients. You will see stroke patients, pediatric patients. We're in the NICU, so you know, premature babies that are born, conjoined twins. We see a lot of that. We see. We work in the OR, assisting the surgeon to X-rays, making sure that he's putting all those screws and nuts and bolts and hip replacements and everything in the right spot, right? We really serve as their eyes where they cannot see. You know, in CAT scan, we a lot of times we'll do biopsies, and so we'll sedate the patient. We'll put needles into your liver or your kidneys or into your bones. We'll take out tissue to help diagnose cancer. In MRI is very different from a physics perspective. In X-ray and CT, we're using radiation and to create those images. But in MRI, we're using a great big magnet. It's massive. It's always on, and so we have to be really careful with those patients, because patients that get an MRI ordered by their physician, we have to make sure it's safe for those patients to even have an MRI. A lot of times the physicians are not familiar with what implants that are in the patient's body actually can go in an MRI and which ones can't, like a pacemaker or some implants. You know, if you've ever been a welder, get welding in your eyes. Have you had your lipstick tattooed on? Sometimes tattoos have lead in them, and they'll heat up and they'll burn the patient. You know, even your undergarments will have copper in them sometimes. And so MRI, you have to be very safe, but you're using a magnet that's kind of supercharged, and it flips the electrons in your body, which then produces the image. In ultrasound, you use sound waves. And so you're looking at inside of a baby's brain, or you're looking at a baby before it's been born, or you're looking for cirrhosis of your liver, or the possibilities are endless. And so, you know, in MRI, you're going to have your patient for about an hour. In CT, you're going to have them about 15, 20 minutes. In X-ray, you're going to have them about 15, 20 minutes. You know, but if you're working in surgery, they're listening to music, or having a chat, you know, you're not talking to the patient, right? So up there, it's more peer-to-peer interaction with the surgeons and the nurses. Everywhere else, you're doing a lot of interaction both with the surgeons and the nurses, but also with the patient. So on average, you're going to probably see 15 to 20 patients in a shift, in an 8-hour shift. So it is very fast-paced. There's not a lot of sitting. And so that's kind of what it's like in a day.
Ms. Michelle, would you like to say something?
So I come at healthcare from a business side. My certification and experience is in revenue cycle. So we kind of keep the lights on. We make sure that in the work that's been done by the hardworking men and women in healthcare is captured, and we get paid for it. And the other piece that we do now that we've got electronic records and a lot of data is it helps us understand what kinds of patients we're dealing with. How can we care for them better? What should we be looking at? So quality improvement and performance improvement, and really the data piece, which is very robust now in healthcare. So if you think you might be interested in, you love computers and you love digging into the data, healthcare really needs you, especially if you're a digital native, because we need to make sure that that not only the information that we're working with is good information, because our clinicians rely on that. They rely on good information in the systems. So that is what I did. And so that's really a lot of computer work. It was a lot of meetings. And and you know what, that's my job now, a lot of meetings and computer work. So it didn't change much.
So I think we had some great discussion today, and we are just 4 minutes, left for this program to end. So any parting thoughts that you would like to share?
I would say find a mentor. That's been critical in my career, is finding somebody that can help me, can guide me. Don't be afraid to ask questions. I get a lot of calls at the hospital. People curious about what we do. We're always happy to answer those questions. You know, we need more healthcare workers. I'm not going to lie. That's probably the thing as an administrator that keeps me up at night, is making sure that I have the staff to safely care for our patients, to provide enough staff so that my existing staff isn't stressed out and overworked. You know, it goes back to making sure that we're mentally healthy for ourselves. If we're not okay for ourselves, we can't take care of patients. So, you know, we're happy to entertain those calls and those conversations, because we want people to come into healthcare. It's a very rewarding profession.
I do want to mention also that's, as Shannon mentioned, that is a great feedback that she provided. I also, as we mentioned earlier, there is a lot of career pathways in healthcare, but I do want you guys to take away that it does take a lot of compassion and selfless service in a field like this. So be mindful of that. If you are one of those that is always providing selfless service to anybody, even if it's just the smallest thing, this is where you belong. So please be mindful of that, and being compassionate about what you do. Some days are very hard, some days are very easy, but this is such a rewarding job. And so being compassionate about being here every day, and providing quality care to the patients is the most important thing.
Well, it is a challenging and a rewarding job, and I'm sure our attendees have learned a lot. We are so thankful for all of you to be here. Thankful to our panelists. We cannot thank you enough. This is a great service, and this is a great information that you've provided us, and you have answered almost all questions. And I'm sure with this program being YouTube, people who have not been able to attend would also go and learn more. So thank you so much. And you all have a great and blessed rest of the evening and rest of the week. Thank you.
Thank you. Good night.
Thank you. Good night, everyone.
Good night.
Thank
Bye-bye.
you. Have a great night.